Hello, it's Bill, the knee pain guru. Today we're going to talk about the challenge with chondromalacia or kneecap pain. This came from a question I received from Brad from South Africa. It was about my program, the Quit Your Quack 6-week knee pain relief program. Brad says he's in his mid-30s. MRI show he has a grade 2 to 3 chondromalacia patella, kneecap pain. Was advised by his orthopedic surgeon to get it cleaned up, meaning they're going to go in there and cut out whatever's loose in the knee, usually an arthroscopic surgery. He wants to avoid it because he's not sure the surgeon had the best intentions for him, have undergone fat and marrow stem cell recently. Diet is spot on. I supplement accordingly and have pretty good lifestyle habits that support recovery. However, I still have this dull sensation coming from his knees. It's hard to explain, but at times a burning sensation and ache. Not sore, but there certainly feels as though there's inflammatory response or something bothering them all the time when he wakes up until he goes to bed. Any thoughts? I got 20 years worth of thoughts. 20 years worth of thoughts, Brad. Question is, will your program work for me? If you believe it will, I'll hop on board. And secondly, if you have any experience with something similar, past patients. Well, I'll answer all those questions. First of all, yes, I've worked with, his name was Ricardo. He was a rugby player out of Italy. We worked with him. He had chondromalacia, a very, very similar issue. What happens is the tibia and fibula get rotated externally, which makes the IT band tight all the way up to the hip. And that rotation of the lower part of the leg tightens the kneecap, patella, onto the front of the leg. So every time you bend, that kneecap is rubbing in a way that doesn't work for the knee. So it ends up essentially shredding the back of the kneecap. The longer you leave it in pain, the longer you leave that dysfunctional pattern going on, the more pain you get. So those are my thoughts. Of course, you're going to have the conventional approach, which is going to look like surgery to clean it up, but it's not going to address the pattern that is causing the rubbing to begin with. You can get shots in there. The shots are going to numb the pain for a period of time. When the shots wear off, the pain's going to come back. Same thing with drugs. And the only other option they really have is going to be physical therapy. Now, physical therapy is going to say strengthen the legs and hopes that the pain will go away. But it doesn't address the dysfunctional pattern that is causing that rotation in the lower part of the leg, the kneecap to rub on the bones every time you bend the knee, and the tension in the IT band all the way up to the hip. So there's that. Those are my thoughts around it. Will my program work for you? Yes, on a couple conditions. One is that you show up and do the work. I just actually had someone the other day who she's like, Bill, your program doesn't work. I was like, okay, well, let's talk about it more, because generally it works. But they don't equate the results that they're getting with work, with something working. This is a comprehensive program. It isn't like, okay, the pain's going to go away like that if you've been suffering with pain for weeks, months, years. There's layers of stuff that go on. And you have to have the mental fortitude to continue to work through that process and not give up the moment you get something difficult that happens. So that's very important. That's the first piece. Second is we have to set up the conditions in your body, which it sounds like you did with diet and supplementation. That's awesome. The very fundamental piece that we need to look at is creating comfort in the knee, releasing the pattern in the lower part of the leg, releasing the pattern going on in the knee, releasing the pattern that is going on in the kneecap, the femur, the hips, the lower back, that is all creating that pattern that is causing all of the tension to go down into the kneecap and make that rubbing in the back of the knee. So comfort is first and foremost, and this is the most difficult part of my program. And people comprehending what I'm sharing, what I'm talking about, the value. Because comfort doesn't feel like anything you've been doing to this point. What you've been doing to this point is pushing through the pain. Think of all of the things that we hear in society. No pain, no gain. Pain is weakness leaving the body. Just do it. Push through the pain. Walk it off. So now, if we have that mentality and take it into trying to eliminate knee pain, it's just not going to work. It's not going to work. It's actually going to make the knee pain worse, which is consequently why there's so many people in pain. They're starting out with the wrong premise of how to get out of pain. We need to start with comfort. That is going to reduce the tension pattern, the tension in the body. It's going to relieve the pressure off of the nerves in the knee that are causing the pain to begin with. And then we look at setting up the conditions in your body and in your life to make comfort work for you. So, Brad, you could show up, you could do that, you could take my lead, take my direction. I'll give you homework, very specific, and you give me that feedback. My program will get you out of pain. My program will create comfort in your knees, and you'll be able to get back to do what you want to do. But if that beginning part, if that's not what you're able to do, then no, it's not going to work for you. No, it's not going to work for you. So, Brett, hopefully that answers your questions. There's some people that are watching the video. If you have any questions about kneecap pain, knee pain, chondromalacia, please ask them below. Say hello. Be happy to answer any questions. If you like the video, give it a thumbs up. Subscribe to my channel, The Knee Pain Guru. If you want to start, it's like, hey, this guy sounds good. I want to see what he has to offer. Head over to my website, thekneepainguru.com. I have a 7-day knee pain reduction challenge that you could begin working with these concepts that I'm talking about, these concepts of comfort, to work with your knee in a way to begin getting relief. The idea with that is you're going to go, oh, there's something to this, and you'll buy my products and programs and get further help. Because I want to emphasize the fact there's so many people that give up. They give up because they don't believe that their knees can be fully out of pain. They blame it on the doctors, the physical therapists, their age. There's nothing they could do about it. That's just how it is when you get older. And it just isn't true. I'm here to share that message because it was 19 years ago this year that I dislocated my left knee 4 times. Reconstructive surgery on the ligament in my left knee, 2 pieces of meniscus taken out, and I saw so many people that had that same surgery before me that were going, well, it's just going to suck the rest of your life. You're going to get arthritis. You're going to, da-da-da-da-da-da-da-da, all these different things on you'll never get your heel to your butt. You'll never be able to do judo like you did before. You'll never get full flexion of your knee, like this whole laundry list of stuff. And that I found just not to be true because I looked outside of the conventional medical model and how that was working and what they were able to offer. So that's what I had to share for today. If there are no questions and no one would like to participate, totally cool with me. This video is going to be up on YouTube as well. So once again, like the video, subscribe to my channel, share this video with your friends, especially the ones that are limping. They could use it the most, especially those crotchety old baby boomers that are like, when you get my age, you'll be begging for a knee replacement. So, yeah, send this to them as well. If anything, just to let them know that there's another option out there besides drugs, shots, surgery, and physical therapy. Anyhow, thank you all so much. Have a great day, and I will see you on tomorrow's video.